In an earlier episode, we saw how, in a way, MSF developed as a result of the Cold War, at the crossroads between emergency medicine and the defense of human rights. But the Cold War ended a long time ago. So today, we're going to look at how MSF has adapted to changes in the global political environment and changes in what has become known as humanitarian space. Here, first of all, are the 60 countries in which Médecins Sans Frontières' different sections were working in 2010. We can distinguish 4 major intervention settings. First of all, epidemics. Measles or cholera in Nigeria, for example, or the AIDS epidemic in places such as South Africa or Malawi. MSF's response to epidemics represents 42% of its activity. Then, natural disasters. The earthquake in Haiti, for instance, or the flooding in Pakistan. These represent 8% of MSF's operations. A third category groups together MSF's programs with communities denied access to healthcare, such as undocumented migrants in France, the elderly in Georgia, prisoners in Russia. Today, healthcare exclusion accounts for 19% of the organization's activity. The fourth and final intervention area is armed conflicts, such as in Pakistan, Afghanistan, and Somalia. They account for almost a third of MSF's activities. What this map also reveals is economic, political, and social changes in the humanitarian environment. In China or Armenia, for example, MSF is dealing with the consequences of the privatization of health systems on access to care. Same thing in Mali or Niger, where the end to free healthcare has driven the poor away from the health centers. In France, MSF is campaigning for access to care for migrants, who are increasingly excluded from the French healthcare system. And in light of the WTO's patent policy or the pharmaceutical industry's lack of interest in tropical diseases, MSF is also campaigning for access to medicines. And then there's the increasing number of so-called just wars. What is a just war exactly? They are standard military operations carried out either in the name of the fight against terrorism, like in Afghanistan or Iraq, or for humanitarian reasons, like in Libya recently. Yet, this is also how the Sri Lankan government classified its own offensives against the Tamil rebellion in the late 2000s. So what really happened? In Sri Lanka, 2 communities had been caught up in an armed struggle since 1972. The Sinhalese, who are mainly Buddhists and form 72% of the population, and the Tamils, who are Hindus and represent 20% of the country's population. In 2006, after a 4-year truce, and because the armed Tamil Tiger movement still controlled 2 zones in the north and east of the country, the Sri Lankan army decided to launch a new offensive. For the government in Colombo, this offensive was supposed to free civilians being used as human shields in the zones controlled by the rebels. It even went so far as to describe this operation as a humanitarian mission. And yet the operations took place without witnesses or assistance. Only the International Red Cross and a UN team with restrictions on its movements were authorized to enter the conflict zone. In just a few months, the army had regained control of the districts of Batticaloa and Trincomalee and driven the Tamil Tigers back to their sanctuary in the Vani. Here it is on the map. Given the way the conflict could develop, MSF approached the authorities with a proposal to open medical surgical projects in Point Pedro, Vavuniya and Mannar in the government zone. But as the humanitarian organization was also pressing for access to the combat zones in the east of the country, the authorities accused it of being partisan and refused it the authorizations it needed to launch its activities. For MSF, this created a dilemma. Should it denounce the situation so as to put pressure on the government and then withdraw? Or should it give in to Colombo's conditions to be allowed to relieve the suffering of the survivors and leave the door open for further negotiations? In the end, in 2006, MSF chose to sign a framework agreement, which meant giving up its attempts to get into the rebel zones. In 2007, the teams were able to start work in Point Pedro, Mannar and Vavuniya, and eventually in Kilinochchi, which was in the rebel zone but a long way from the fighting. MSF never gained access to the combat zones. In 2008, the army tightened its grip on the Tamil Tigers even further. After taking back the district of Mannar and then of Kilinochchi in the summer of 2008, the government ordered humanitarian organizations out of the Valley. The final assault launched in January 2009 was essentially carried out behind closed doors. MSF was forced to move away from the military operations areas. But because it was still working in Juan Pedro and at the Vavunia hospital, it heard reports of what was happening from the injured. They described all-out war, with no mercy being shown to civilians. In less than 5 months, between 20,000 and 30,000 people were killed by bombs, and 300,000 others were evacuated to internment camps, which rapidly became overcrowded. So the Sri Lankan government then turned to the UN and its financial backers for help to build a new model camp, Menik Farm. Meanwhile, it had succeeded in bringing humanitarian operators to heel by demanding that they stay outside the camps, operate within the health framework established by the authorities, and undertake to make no public statements. MSF eventually signed a second framework agreement in 2009, which allowed it to work in a hospital close to the Menik Farm camp, but not inside it. The question raised by this Sri Lankan experience is what price we are willing to pay to be allowed to take action, and just how far can we bend our humanitarian principles? Let's look at another example, Pakistan. Here in the north of the country, these mountainous regions in Khyber Pakhtunkhwa province are the tribal areas. The population here is affected by at least 3 types of violence. Sectarian violence between Sunnis and Shiites, such as seen in the Kurram area in 2007. Military violence due to the conflict between the Pakistan Army and armed opposition groups, as in Bajar Agency in August 2008. And don't forget that this region is also home to some Taliban strongholds, such as North Waziristan, and thus attracts operations by American Special Forces and unmanned drones. In 2008-2009, MSF was working for the first time in the Swat Valley, then controlled by armed opposition groups, where it was making up for a shortage of health professionals. But the teams had a problem. The Pakistan Army, which launched an offensive in the Swat Valley in 2009, was using aid as a means of re-establishing the government's legitimacy with the local population. As a result, the humanitarian organizations working in the valley were considered part of the government's stabilization policy and were therefore at risk of becoming targets for the armed movements. So what were the options? As it did in Sri Lanka, MSF again sought a compromise. In 2010, in order to continue its activities in the Swat Valley and make itself less visible, MSF managed the programs remotely, while its Pakistani personnel implemented them on site. Remote management is a means of operating without the permanent presence of expatriates and has been used by MSF over the last few years to preserve its freedom of action in countries such as Iraq or Somalia, where the security conditions would otherwise prevent relief from reaching the populations. Now for the third example, Yemen. Here on the map you can see the Sada Governorate, where, since 2004, government forces have been fighting an armed rebellion led by a former member of parliament. To bring relief to the region's population in 2007, MSF set up a base in Haidan, Razeh, and then in Altal in the government zone. But the conflict gradually expanded, and in 2009, MSF found itself in a zone controlled by the rebels. There was no media on site, and MSF was one of the rare witnesses to the violence of the conflict, the bombing of civilians and the attacks on health facilities. Yet MSF didn't launch a communication campaign. It confined itself to reporting on the escalation in the violence and the lack of healthcare services for the population in its annual report and in an institutional campaign. But because it was one of the few humanitarian organizations on site, much of what it said was picked up by the media. And the Yemeni government immediately suspended MSF's activities in Yemen. The organization therefore decided to publicly withdraw its statements, apologize to the authorities, and promised to keep quiet in future. It managed to stay in the country, but also gave free rein to government propaganda. Sri Lanka, Pakistan and Yemen. Here then are three examples of countries where MSF chose not to abandon the population and in doing so was forced to partially renounce some of its principles. We could also cite Niger, Sudan, Myanmar or Ethiopia. And yet the volume of MSF's operations and actions has never been higher than it is today. So why is this? It's because the real purpose of humanitarian action is to provide relief to victims of disasters, whether man-made or natural. MSF has chosen to give priority to the reality of the field, rather than to law or politics or rhetoric. Sometimes the price for doing so is keeping quiet. In retrospect, the Cold War equation was simpler. Today, aid operators are working in a much more complex world.